Hi guys, I'm Dr. Tara Tobias. I want to welcome you all back to this channel. In today's video, we are going to talk about walking. Not necessarily like I've done in previous videos where I've broken down walking into different components and taught you some ways to work on one little section of walking to improve the overall quality of your walking. This video is primarily going to be on some of the benefits of just walking in general, what the evidence is saying, how that evidence is being interpreted and used to design programs for patients in a physical therapy clinic. And hopefully by the end of this video, you will know how walking in general, as far as distance, speed, things like that, how that fits into your plan based on your goals. But before we dive into all of that, if you're new to this channel and you haven't yet subscribed, go ahead and hit that subscribe button, turn on that notification bell so that you'll get notified every time I upload new videos. And now let's go ahead and dive into the content of today's video. So first, I'm going to start out with a serious question. How many of you regularly spend the first 15 minutes of your physical therapy session in an outpatient setting on a bike? And maybe someone is monitoring your vitals, maybe not. Maybe you're just sitting on that bike alone before you get into your physical therapy with your physical therapist. Or how many of you, maybe you're not in outpatient physical therapy anymore, but remember when you were in outpatient physical therapy, spending a long time or a huge portion of your physical therapy session walking. Whether that be walking up and down a hallway or walking in a circle with your therapist walking next to you. And the reason I ask is because this is becoming more common in the US, and there is some rationale behind this. So in recent years, there has been a growing consensus in the research that increasing the amount of walking you do in therapy improves your walking outcome. Some measured that by increase in walking distance. Some studies measure that by speed, but there's been some improvement in your walking once you stopped doing therapy. And then there's a bigger body of evidence that I would put in another silo of locomotor training or body weight supported treadmill training that became very popular, showing that if someone did a lot of stepping, like 4,000 plus steps on a treadmill, there was some carryover that that person or that individual took more steps outside of therapy. And then in those studies, they also found when they looked at physical therapy programs, outpatient physical therapy programs, that on average, therapists or patients were walking less than 400 steps a session. So the idea was that we weren't walking patients enough in therapy, and lo and behold, exploded this huge push to just walk in therapy. It didn't matter how, it didn't matter with what assistive device, it didn't matter the quality, just get those steps in. And a lot of physical therapy clinics in the US adopted this philosophy. Now, when it comes to those of you that were put on a bike, there was some rationale behind this as well, because there's another silo of literature that is growing, or this body of knowledge that is growing, that cardiovascular exercises had some benefit in your body's efficiency. They also found that people that did some kind of a cardiovascular exercise, this improves synaptic plasticity, which a lot of you are familiar with those terms. I talk about it a lot on this channel, and it's really just big buzzwords in the stroke recovery, brain injury recovery community. But is there a trade-off? And if so, I feel like it's not getting talked about enough, and therefore we're just continuing on in this trajectory where physical therapists are just walk. Next therapy session, walk. And over you go, taking tons and tons of steps in therapy because you got to get those steps in during a skilled physical therapy session. But is this the best use of physical therapy time with a licensed physical therapist? Well, I don't necessarily think so. First, in my opinion, putting you on a bike, you as a patient, putting you on a bike for 15 minutes isn't necessarily skilled. Now, there is the argument that I'm monitoring your vitals, and then that's where the skill comes in. But honestly, I could probably teach you how to monitor your vitals in one session. Do I think that a therapist should be involved when developing an aerobic exercise program? Absolutely. You do need to know how to monitor your vitals, how to look for warning signs or red flag signs of when something is not right or when your heart rate is not adjusting appropriately. Definitely, there is some education that goes into that. But honestly, once I know that you can monitor yourself, I don't really need to do it in therapy with you anymore. And now let's talk about the neuroplasticity when it comes to putting you on a bicycle and having you do that bike for the first 15 minutes of every session, 60 RPMs, that's 60 revolutions per minute for 15 minutes. And let's say your leg is flopped out to the side, or let's say your foot is supinated on the pedal. Well, a lot of times they'll just strap your foot to the pedal. But does that really help? Does your foot stay flat or is your foot still supinated? Well, as I've said before, there's positive neuroplasticity in stroke rehab and there's negative neuroplasticity in stroke rehab or brain injury rehab. Positive neuroplasticity is that you're creating experiences for your body that is causing your brain to rewire around this experience, hopefully resulting in rewiring on the damaged side of the brain. Now there's also compensation. So that's facilitation. There's also compensation. A lot of times you don't have to teach someone how to compensate. They just naturally do it after a stroke or a brain injury, where you just compensate by using the strong side of your body. Well, in this scenario, they actually see rewiring going on the uninjured side of the brain, and even worse, they actually see the injured side of the brain actually sending resources over to the uninjured side of the brain. That's a very simplified explanation, but big picture, simplified, that's what's going on. So now you're taking neurons from the damaged side of the brain and you're reallocating those resources over to the uninjured side of the brain. Why? Because that stronger arm is doing all the work and our brains are very adaptable. And so it makes more sense that you need more resources over on that side of the brain. I call that negative neuroplasticity. So when we talked about plasticity in general, and I've talked about it in other videos, one of the key factors is repetition, doing a movement over and over and over again. So let's go back to the bike. You are doing that movement over and over and over again. So I understand the concept or the idea that the bike is an aerobic activity, but I think the trade-off is that you are then going to have that movement pattern hardwired onto your brain. That's kind of my first critique of this idea of putting you, the patient, on a bicycle for the first 15 minutes of your physical therapy session is we might possibly, or there's a strong chance that that negative neuroplasticity is going on. They really don't know how much you're pushing with your uninvolved leg or your involved leg, so there is probably a good chance that you're just using your stronger leg and therefore driving more of those resources over to the uninjured side of your brain. So again, I really just ask the question, is that the best use of your therapy time? And is that what you're currently doing during your skilled physical therapy sessions? Comment below. Now let's talk about the walking, because this is becoming a growing trend that patients are telling me, is that in other clinics, they are spending their entire hour just walking. And I think, I don't know because I'm not in the heads of those therapists, but I think they're applying some of this literature that we need to be getting more steps in therapy because that translates to more steps outside of therapy, which is a good thing, right? Well, then there's even more evidence in those studies saying that you're also at a decreased risk for falls and your walking speed is increased. All positive things, right? You're not going to fall, you're walking faster, and you're walking further. So why not just walk you in a circle every day, session after session in therapy? Well, if you've been watching me for a while, you know by now I am obsessive about quality movement. How many videos have I done just on one little component of walking, one little exercise, or one little video on bending your knee through swing phase, not hiking your hip up, not circumducting? A ton. And why do I do that? Because I also see people that are 10, 15 years down the road that now have arthritis in their uninvolved legs. So now they can't stand on one leg and now the other leg is breaking down because they've had all these compensations. They have back injuries. Their walking is now even worse because they have less use of the involved side or the weaker leg or the side that was affected by the stroke, because for 15 years they've been working more and more and more on walking faster and putting more and more weight onto the uninjured leg or the uninvolved leg. This is a problem. And I really do think that there is no way to avoid these situations if all you're working on in therapy is walking faster and walking further. So what is the answer? If there's all these health benefits to walking further, walking faster, adding aerobic activity, what's the solution? Because I see all the value in the things presented in these papers. Well, one is you could go to a facility that has what they call an exoskeleton, which it is a body weight supported treadmill. So you're harnessed over a treadmill, but you have a exoskeleton on the outside of you that's facilitating a normal movement pattern for 20 to 30 minutes. And those are great programs. And there's several of those across the country. So you could do that for 3 times a week for 20 to 30 minutes. But how realistic is that for the majority of you? Not very realistic. So then what are you supposed to do? How do you work on quality while also get some of the health benefits that are clearly there with aerobic training? Well, I think you can. I think it is possible. I think step one is, and I don't care if you're 1 year out, 2 years out, or 5 years out, I think one component of your daily rehab could focus on quality movement. And again, I've done a ton of videos. Find your impairment in my list of videos, or find your problem area in the list of videos and do those exercises every day. Repetition, repetition, repetition. Get that quality, maintain that quality, never give up on trying to improve that quality. If you're doing it every day, you are gonna get better. It's gonna be incremental and it may not seem like a lot, but let me tell you, if you stop doing it, what's gonna happen is what I had mentioned earlier, those patients that come back in 15, 20 years down the road and now they have arthritis and they have all these other orthopedic issues because they have been doing this abnormal movement pattern for so many years. And then I think the second component of a well-designed home program does need to be some sort of higher intensity aerobic training. But it doesn't necessarily need to be walking on a treadmill, right? There are things that you can do to get your heart rate up without necessarily getting on a piece of cardio equipment. For example, you could do some kettlebell activities, but do them sitting. You could do some seated punching. I think you could adopt the HIIT kind of philosophy, which is high intensity interval training, which is 30 seconds on and 30 seconds off. So I definitely think you could adopt that without compromising the quality of your movement. My suggestion is find things you enjoy to do and change it up. Anything you can do actively, you could do it sitting down. If you're higher level, you could do it standing, but not necessarily stepping. Like let's say the swing phase on your involved leg looks really funny, or you circumduct, or you hike your hip up. Well, do something standing, but not necessarily something where you're forward stepping. There are a ton of things that you can do during that 30 seconds on to get your heart rate up, follow that by a 30-second rest. And I think it's a realistic or reasonable goal to work up to doing this 20 minutes a day, minimum of 5 days a week. So I hope you enjoyed those examples or ideas of things that you could do to incorporate more activity or more aerobic training into your home program without compromising movement. If you have any questions about this, definitely leave those in the comments below. If you have any experiences like the ones I described, I would definitely like to hear about that in the comments below as well. Thank you all so much for watching. I enjoyed spending time with you all, and I will see you in the next video.